Nephrology. In the Greek, nephros means kidney. The suffix ology means the study of. You put them together and you have this man, Dr. Vincent Anthony, a 40-year-old Los Angeles-based nephrologist who specializes in kidney treatment and education.
When you get into the nighttime hours, when you're asleep, whenever I hear 2 or more times that one is getting up to use the bathroom, then I have a sneaky suspicion that it may be the kidneys or some part of the urinary tract that may have a problem.
Raised in Jackson, Mississippi, he completed his undergrad and grad studies at Tulane University of New Orleans and received his medical degree from Medical College of Thomas Jefferson in Philadelphia, Pennsylvania. While studying, something happened that changed his life and his medical direction. Rather than becoming a cardiothoracic surgeon as planned, he chose to become a nephrologist, inspired by a couple of family tragedies.
2 of my loved ones died because they didn't have access to dialysis in a different country. And that kind of pushed me into wanting to do kidney disease. And I have a passion for it because they didn't have access and they were so young. So the question is, why did they have to perish because they didn't have access to dialysis? And then I started thinking, well, why did they reach dialysis in the first place?
That was cause enough for him to create his own crusade to educate his people.
Kidney disease is important because it leads to heart attack, stroke, obviously kidney failure, and other ailments that you may see. Immune dysfunction happens. Blood dysfunction happens. Bone dysfunction happens. So the kidney is kind of a window on the world in terms of what's going on with the body as a whole.
Dr. Anthony says there are 5 stages of chronic kidney disease.
Stages 1, 2, 3, 4, and 5. 5 means you need dialysis. And a lot of people out there know someone or they themselves are on dialysis. 40%, it's estimated that 40% of patients on dialysis are actually African American. But there are many other groups that are affected by kidney disease just the same.
He's traveled to churches and civic organizations throughout Southern California on a mission to educate the people on how to prevent kidney disease.
The kidney is a ball of blood vessels that filter blood and get rid of waste products. Anything you do to help the blood vessels, you're doing to help the kidney, and vice versa. So therefore, exercising regularly, making sure you're maintaining a hydration status or making sure you're taking in the appropriate amounts of fluid, laying off of the salt, which raises blood pressure and puts pressure on the kidneys to function, and watching your blood sugars, particularly if you have family members that have diabetes, putting you at risk for diabetes. You may be in the pre-diabetic range, and although you don't have the definition of diabetes, your kidneys are still being damaged by the sugars that you're putting in your body.
If you'd like more information or would like Dr. Anthony and his staff to come to your church or organization to hold a health fair, call 1-800-KCARE11 or visit kcareonline.com.